In this video, we will demonstrate how to determine the expected length of stay of a patient entering the hospital through the emergency room by modeling the process as a continuous time Markov chain with absorbing and transient states. The context for this problem is the Medical Center Hospital of Odessa, Texas, a nonprofit hospital serving the greater West Texas region.
My name is Chad Donovan. I'm the Assistant Divisional Director of Acute Care at Medical Center Hospital. We serve 17 surrounding counties. We are a Level 3 trauma center. We also have a lot of outlying area town hospitals that feed a lot of patients through our ER or direct admissions. The emergency room is our main source of admissions. Probably anywhere from 70 to 75% of our admissions come through the emergency room. Once they go through the emergency room, the doctor determines if that patient should be admitted or sent home from that point. We have all kinds of patients that come through there, anything from pediatric patients with colds, fevers. We have traumas, car wrecks, just whatever you can think of. We pretty much get those types of patients. We have medical surgical units that take care of your basic sick patient. We have telemetry cardiac units that take care of the cardiac patients that have interventions done, that have anything that has to do with their heart, even trying to control their heart rates with medications or with other types of devices. Really, our emergency room is the main place to where, like I said, 70 to 75% of our patients come through there and are admitted by those physicians, and according to what's going on with their situation, their illness, they put them through to the proper unit that they need to be admitted at. Also, the length of stay with these patients also is determined by the type of illness that they are diagnosed with. The length of stay can be anywhere from a 23-hour observation patient to where they go home the next day. They just want to run some tests, rule some things out, or they can be in the hospital for 3 to 5 days according to DRGs and all these other things that insurance companies use to determine how long the patient should be in the hospital for that illness. We also have patients that are here even longer than that. We find some that, when we're looking for nursing home placements or long-term care placement, they can stay in the hospital anywhere from 5 days to 25 days. Of course, that is a constant struggle trying to find placement for patients outside the hospital. We keep an average daily census up here of around 23 to 24 patients. The patient load up here is anywhere from one nurse having 3 to 6 patients, depending on the type of patient, how sick the patient is, and the actual patient load that nurse can carry. Patients turn on the TV, they select the program they want to watch according to their diagnosis, to what's going on with them. Even if they just want to relax and watch waterfalls or hear, relaxing music, that's all through that system there. We have these whiteboards here. These basically give the patient the information on who the unit director is, what their nurse is for the day, who their nursing assistant is. Like right up here, we put a lot of important information, like if they want their daughter's phone number, if they, can't remember their family's numbers, we put their numbers up there, or specific dates for certain things, or if they have tests or anything going.
The emergency room is frequently one of the large sources of admission to a hospital. Arriving patients will stay some length of time in the emergency department where they receive treatment and are then either discharged or admitted to one of the specialized care units in the hospital. In these units, the patient will occupy a bed some length of time until they are recovered, and may move from one unit to another during their length of stay. The Medical Center Hospital would like to determine the expected amount of time a patient arriving to the ER will spend in the hospital prior to being discharged. Though the problem presented in this video is representative of one in that industry, keep in mind that all data given in this video is fictitious and for illustrative purposes only. Assume that the hospital has 4 care units, consisting of the emergency department, intensive care unit, telemetry, and cardiology. and assume that for each of these units, the distribution of time a patient spends in the unit prior to being discharged from the hospital or moved to another care unit is exponentially distributed with the following average times. The assumption of exponentially distributed lengths of stay in a unit implies that there is considerable variability in the actual time an individual will stay, and occasionally there will be a patient that stays for a very long time. Both of these assumptions, however, are often typical of services in a hospital. Upon departing from a unit, a patient is discharged from the hospital or moved to another care unit according to the following probabilities. Note that while patients are probabilistically moved from the ER to other units, patients are not moved from other units to the ER. In addition, once patients are discharged, they are not readmitted to other units in the hospital. That is, they are absorbed. The following problem is presented. For a patient arriving to the ER, what is the expected amount of time they will spend in the hospital prior to being discharged? The problem of obtaining the expected length of stay in a hospital for a patient arriving to the ER may be found by modeling the process as a continuous time Markov chain with absorbing and transient states, and then solving for the mean reoccurrence times of individuals prior to absorption. In particular, the stochastic model is given by the following. Letting the matrix Q denote the generator matrix of the continuous time Markov chain, the elements of Q may be found by multiplying the 1 divided by the expected length of stay in each unit, or the rate of departure from a unit, by the probability of transferring from one unit to another or to discharge, and then summing over the rows to get the diagonal elements yielding the matrix. Note that the expectation of time in each unit has been expressed in days in the Q matrix. In particular, 4 hours is given as 1/6 of a day. The Q matrix may be partitioned as follows, where V is equal to the matrix of transition rates between transient states. Letting Nij represent the random variable that denotes the amount of time a customer spends in state J given they started in state I. It follows that μij is equal to the expected amount of time a customer spends in unit J given they entered the hospital in unit I, and letting N equal matrix of mean residence times μij's.